So the first question, what would cause the body to hold on to fluid even while taking Lasix? Besides steroids, could it be something more serious? Fluid retention, or what we usually cause edema, is oftentimes treated with diuretics, such as this person is taking Lasix, or what's also called furosemide. There's many potential causes for fluid retention. That's a really complex issue, by the way. Steroids can definitely cause fluid retention or edema, but also just getting older, just being overweight can cause fluid retention and edema. Vascular problems is one of the most common. As we get older, our veins in our legs, which usually help to get fluid out of our legs on a regular basis, they stop to work normally, and a lot of people get bad edema or swelling in their legs just simply from the aging process. Or a lot of women, when they go through pregnancy, they know what that's all about because they get a lot of edema and swelling in their legs for the same reasons. Medications can do it. For example, Lyrica, which we use for fibromyalgia, very common cause of edema. Gabapentin and Neurontin can also do it as well. The non-steroidal anti-inflammatory drugs for pain oftentimes can cause edema. Lupus nephritis, kidney problems, heart problems. There's really a whole host of reasons for having edema. If someone has edema or swelling and it's not responding to Lasix, then you really need to see your physician and find out why you had the edema in the first place. And then plus you probably need to be on a higher dose of Lasix or even a stronger diuretic. If I don't have kidney problems, why would a person have protein in their urine? There's a lot of potential. I'll go back to one of the things that we always check in our lupus patients is a urinalysis or urine sample. And the reason for that is that about 40% of lupus patients can develop inflammation of the kidneys, or what we call lupus nephritis. And it's really important to pick up early because most of our patients were able to get them into remission and make them feel a lot better by treating their lupus nephritis. But there's a lot of other things that can cause protein in the urine, and we always got to be thinking about these as physicians. For example, just an unclean catch, just someone collecting their urinalysis and not doing it properly. If they get cells from around the urethra, that can actually cause a high protein, and so we always got to make sure that it was actually done well in the first place. If someone has red blood cells from their menstrual cycle, that can cause it. If someone's been exercising a lot, actually exercise, a high percentage of people who exercise regularly will have a little bit of extra protein in their urine as well. So there's a lot of different reasons for having extra protein in the urine, and it is up to the doctor to figure out what that cause of the extra protein is. But lupus nephritis is one of the main things that we're worried about.
Doctor, we have a question from the audience.
Thank you. This is in response to the question about edema.
Yes.
If that's primarily caused by poor circulation and sitting too much, and we're in too much pain, and we're too weak, and we're too dizzy, and too stressed, so we sit, what can we do?
Vascular support stockings can be helpful. Propping up the legs, and to be honest with you, when someone has really bad edema and they can't improve it with the diuretics and the stockings and the exercise, I actually send my patients to a vascular clinic because some people have such bad edema that me as a rheumatologist, I don't know all the tricks in order to control it, but there's actually very good clinics in our area. We actually have lymphedema clinics that's all they specialize in, and I really don't know all the tricks. I'm sorry about that. I know all the rheumatology tricks, but not the tricks for like edema. But vascular support stockings every single day, taking diuretics, getting rid of sodium and salt in the diet. Those are the basic ones that I know to do. And exercising while you're sitting, exactly, yeah. And I forgot to mention that using the muscles in your legs will help pump the fluid out of the legs, so that's also very important. Okay, so in the next question, if I went into the hospital with fluid on my heart and lungs, what would cause that to happen? I could hardly breathe, and I had to be on the breathing tube, feeding tube, and intubated. I was in the ICU for 18 days and hospitalized for 20 days. So fluid around the heart and lungs, there's also a lot of potential problems for it. For example, in people who don't have lupus, infection can potentially do it. Kidney failure can potentially do it. Liver failure can potentially do it. But in our lupus patients, by far the most common reason is what we call serositis. The serosa are the linings around the lungs and heart, and when the heart contracts and expands and when the lungs contract and expand, they're actually in a bag called the serosa, and there's like an oil lubrication or a fluid between them that acts like lubrication so that it pumps really easily within that bag called the serosa. But lupus loves to attack the serosa and causes something called serositis. Pleurisy is the main thing that most people have heard about. Pleurisy is one of the most common things that we see in our patients with lupus, and so lupus will attack the lining of the lungs. Then every time the person breathes, it's very painful because instead of being lubricated, there's all this friction from the inflammation, so they try to take in a deep breath, and they can't because it hurts them so much. But in some people, the lupus can cause so much inflammation in that lining around the heart and lungs that they'll actually get a lot of fluid buildup, and sometimes we actually even have to stick a tube in there and drain the fluid out. And if it's severe enough, someone can end up on the ventilator like this poor person did. I am tempted to sometimes stop taking my meds or not being regular with them because I just get tired, mad at having to take it, all of them, saving on costs. What's your thoughts on this? And this has to go back to my slide that the number one cause of our patients not doing well is noncompliance, and not taking the medicines is one of them. I'm not a patient, and so it's hard for me to know exactly what someone's going through, but I can say that denial and anger and getting tired of taking care of yourself is a natural part of the process of dealing with a chronic disease. Support groups, I think, are incredibly important. Molly's Fund does have a support group here in Portland, also a couple on the internet. There's some great online support systems, and I think it is so important to talk to other people who are going through the same thing, because as a physician, I can tell you it's important you take your medications or you're going to do wrong, but it really, I think, is more helpful to talk to other people who are going through the same thing that can tell you what worked for them in learning to take their medicines. On Facebook, there's a great site called Lupus and Me that people like to go to and talk about their problems. I think that's a good one as well. There's a very good book called Despite Lupus by Sarah Gorman. She was a lupus patient who had severe lupus. She denied it. She didn't want to take her medicines. She was tired of taking her medicines. And it's a very easy to read book, but she takes you through the whole process of how angry she was. She wanted to stop her medicines. And then finally what brought her around to start to take control of her own life. And it does have to go back to this hope thing. It's really important that you learn how to control lupus and not let it control you. And I wish I had an easy answer, but I think that people do have to go through these processes of going through denial and anger and such before they learn to take their medicines regularly. Next one, lowering Plaquenil from 400 milligrams 7 days a week to 400 milligrams 6 days a week. Will that work in place of 300 milligrams per day? That's a good question, because most people won't even think that that's a possibility, but it is. The nice thing about Plaquenil is that it has what we call a really long half-life. When you take Plaquenil, and if you stop it, 5 years later, we can still find Plaquenil in the urine because it stays in the body a long time, as opposed to a medicine that has a short half-life. A medicine that has a short half-life, you take it, and it's metabolized very quickly. You have to take it like several times a day, 4 times a day, 5 times a day. Plaquenil, you can actually get away with taking it 6 days a week as long as the total average dose is the same as taking it every day. So that's actually a very good question, and that actually can be done. What I do, by the way, is on patients who take 300 milligrams a day, I usually have them take 1.5 a day. Some patients hate to cut their pills in half, and so in them I'll have them take 2 on one day and 1 on the next day, so 2 alternating with 1 instead of 300 milligrams a day. Discoid lupus, found out I have it. Can it turn into systemic lupus? What should I be concerned about? Do I have to worry about medications I take affecting my lupus condition? And do I still have to worry about the sun? So discoid lupus, unfortunately, can turn into systemic lupus, but it's only probably about 10% of the time, maybe as high as 20% of the time. The studies are all over the place. But most patients who have discoid lupus, by the way, I'm sorry, discoid lupus is one type of skin lupus called cutaneous lupus. Like if you know the singer Seal, if you notice all the pock marks on his face, that's actually from discoid lupus. But sometimes lupus can just attack the skin, or what we call cutaneous lupus, and discoid is one of them. Most people with discoid never develop systemic lupus. When I see someone who has discoid lupus, what I do is I check all the blood work, And if they're negative for ANA and negative for double-stranded DNA and all the other antibodies, they're much less likely to develop the systemic form over time. But if I see any of those antibodies, I watch that person like a hawk, because if I do see them start to develop systemic symptoms, I want to treat them right away. See, do I have to worry about medications I take affecting my lupus condition? Usually not with discoid lupus. There's another type of lupus called subacute cutaneous lupus. It's not very common, but that can actually be caused by some blood pressure medicines. Like there's a set of blood pressure medicines called calcium channel blockers that can actually cause this particular type of lupus. So we always make sure that patients with that particular type of skin lupus problem stop those particular blood pressure medicines. People with discoid lupus should still probably not take sulfa antibiotics, because that can flare up lupus, and so that'd probably be the main one I would recommend not taking. And then do I start to worry about not being in the sun? Please no. The sun is very bad for discoid lupus. You should still be using all the sun protection advice that's in the handout. Do I need Prevnar PCV13 shot if I have other autoimmune disorders? If you have an immune disorder where your immune system is not acting properly, or what we call an immunodeficiency problem, then absolutely yes. It's basically if you have an autoimmune disorder where you're having to take medicines that suppress the immune system, that's when you need to get the Prevnar PCV13 vaccination. If you don't take one of those immunosuppressant medicines that I put into the handout, you probably do not need the Prevnar shot. Can I have a baby? I cannot take Plaquenil, and I have to take 20 milligrams a day of prednisone and methotrexate. 20 milligrams once every 7 days. I have flare-ups if I try to stop methotrexate, and if I decrease prednisone, all over my body pain increases. As far as lupus and Plaquenil, I don't know the full story on this person, but I would at least see if they could take tiny doses of Plaquenil, like even a half tablet a day or a whole tablet a day. If they couldn't tolerate that, I would see if they could take chloroquine, which is another antimalarial, also quinacrine, so I'd try them on the other ones if they couldn't take the Plaquenil. There's a lot of other medicines we can use to treat lupus besides methotrexate, and some of them are very safe to take during pregnancy, especially the one called Imuran. So if I had someone who had lupus and they wanted to become pregnant, I would switch their methotrexate to Imuran if that was possible, or even try something like Benlysta to try to get them off the methotrexate. The vast majority of our lupus patients today, by the way, have successful pregnancies. And there's a laundry list of things that person should do, and if this person comes on my Facebook page and sends me a note, I'll be glad to send them the list of things they should do to have a successful pregnancy. In 20 years of taking care of lupus patients, I have not had one lupus patient who wanted to become pregnant not be able to become pregnant, but it does take a lot of work. But you can't take methotrexate and become pregnant. So how does coconut oil or avocado help with lupus and fibromyalgia? Again, the supplements, you really have to question the efficacy of supplements, and so I really can't recommend them. The only thing I know about avocado is that there was a recent study that showed that there's a supplement that uses soy and avocado mixture that might actually help osteoarthritis, but I haven't seen any good benefits for either lupus or fibromyalgia. And by the way, if the supplements were so great for fibromyalgia, by the way, then why aren't they curing the fibromyalgia? I wish it was that easy, because I feel so horrible for my fibromyalgia patients. It's the hardest thing to treat. We know that using tanning beds isn't good for our skin, but it helps our bodies with feeling so much better. So what about infrared sauna or mineral hot springs? Well, mineral hot springs sounds good and safe. I don't know enough about the infrared sauna, so I'll have to plead ignorance with that. But please no sun tanning, because that can definitely cause severe lupus flares. And try to figure out other ways to feel good. Massages, I don't know, exercise, other things other than a sun tanning booth. Why is acyclovir prescribed to some lupus patients? The only time acyclovir is an antiviral medication that we use to treat herpes. And so some patients with lupus who take immunosuppressants, if they have recurrent like cold sores on the lips, that's actually due to herpes, or if they get recurrent shingles, or if they have genital herpes, then it's important that they take acyclovir on a regular basis to prevent herpes outbreaks. And the reason for that is that when you take an immunosuppressant, sometimes the herpes virus, which lives inside of our body the rest of our life, it can be really active and it can actually cause a severe infection throughout the whole body. So we want to prevent that severe infection from happening. That's the only reason I would give acyclovir regularly to a lupus patient. I am a lupus patient. What is your take on medical marijuana? All right. For glaucoma, weight loss, and rheumatoid arthritis. First, I'll say that I do believe that medical marijuana has some medicinal qualities because it does act on certain receptors in the brain. But separating out how do we take advantage of the medical parts of marijuana and get rid of some of the bad parts, that's the part that I feel uncomfortable with and I just don't know enough about. I do know that we have a pill that we actually have that uses THC that we actually use for severe nausea in chemotherapy and actually does use the THC qualities of marijuana. I know that there are some studies showing some efficacy with chronic pain and fibromyalgia and also glaucoma, and so I think that it does have a place in the future, but I personally don't feel comfortable with prescribing because I just don't know enough about it. For lupus and medical marijuana, I would say absolutely not. And the reason for that is that a significant proportion of our patients do get lung involvement from their systemic lupus. And we know that in our patients who get inflammatory lung disease, that the ones who are at highest risk of getting the inflammatory lung disease are those who smoke cigarettes. And we know that in cigarettes there's so many different chemicals that can potentially do that, or is it the heat from the smoking? We don't really know. And I would just hate to see a patient use medical marijuana through the smoking part of it and possibly cause lung damage or inflammatory lung disease. It just has not been studied, and so we definitely can't recommend it for our lupus patients. Could they possibly use the medicinal parts and have it in a pill someday that's safe? I think that's very possible. But it's definitely too premature for medical marijuana and lupus. Well, I know I'm going to get that question a lot because Washington, D.C. and Maryland are looking on legalizing marijuana. So I'm going to get those questions. I am taking budesonide, which is a cortisone, instead of prednisone. Is this a good thing? The bottom line with the steroids is that there are a lot of times are interchangeable. There's a lot of different steroids that we can use, and some patients will tolerate some steroids better than another. And so I do have some patients that I'll have them on methylprednisolone or prednisolone instead of prednisone. So it doesn't matter a whole lot as far as which exact steroid that you take. Except I think that budesonide, I do believe that that's one of the ones that can help what we call neonatal lupus. Unfortunately, some women, if they have SSA antibodies and SSB antibodies, those antibodies can actually go through the placenta and actually attack the baby, and it can actually cause them for their hearts to not work properly, and we give some steroids to prevent that from happening. I think that budesonide might be one of the ones that we use to do that because it crosses the placenta. You can tell I have those 50-year-old eyes. I got to hold this out. Okay, so longer-lasting infections might be due to adrenal fatigue insufficiency. And as from my comment that I made earlier about when you get sick with an infection, some lupus patients who take steroids for a long time might have more difficulty getting through the infection. So low-dose prednisone might be helpful. But prednisone is immunosuppressant. Seems counterintuitive, and can you elaborate? Such good questions. So it has to go back to how our bodies deal with stress. And certainly steroids and prednisone at a high dose is immunosuppressant, and so certainly can make it more difficult to deal with infections. But just think about it. What does our own body do when we get a bad infection? It churns out 20 milligrams of prednisone. So it's important for our bodies to get through stress. So certainly taking high doses of prednisone can be very bad for infections, but also can help people who do have the adrenal insufficiency. And by the way, if I have someone who has adrenal insufficiency because they've been on prednisone a long time, I don't put them on a high dose of prednisone. I don't put them on a dose that suppresses the immune system. I would only put them on like 7 to 10 milligrams a day, just enough to give them enough to get through the infection and have just a little bit of what we call stress best doses of steroids. I am a lupus patient. I take prednisone 10 milligrams a day, which leads to sore muscles. And the sun makes it worse. And why is that? Steroids have a lot of side effects, and anyone here who's taken steroids unfortunately knows that. Muscle pain and joint pain are one of the potential side effects of prednisone. One thing you can try is you could try a different type of steroid, such as methylprednisolone. A lot of my patients who can't tolerate prednisone, they'll have less side effects on prednisolone, so that's one alternative. If the sun makes it worse, I really have to wonder if that's the lupus that's doing it, rather than interfering with the steroids. And so I should say, first of all, you shouldn't be out in the sun, and you need to use that sunscreen regularly. But I think it would probably have more to do with the lupus than with the steroids. So that's my answer on that, I guess.
I don't mean to interrupt, but SPF recommendation, and I just noticed that last week at the store they said it was 110.
So the question is, what amount of SPF should be used? And there's no real good answer to that. In fact, they're showing that the higher you go up on the SPF, it's actually less effective for each step that you go up. But I think the bottom line for lupus is that the higher SPF you can tolerate, the better. But some people can't tolerate very high amounts of SPF because the higher you get up on the SPF, the gookier the sunscreen is. And I think most of you can relate to that. And so it's really hard for some people to tolerate those gookier sunscreens. So what I recommend that patients do is experiment with different sunscreens and find one that you can use that has the highest SPF that you can tolerate yourself. But the higher, the better. And by the way, other countries, by the way, have much better sunscreens than we do. Hopefully the FDA will start to legalize those here so that we can have even better sunscreens for our patients. That's a good question. I guess? Then? Okay, so that's it, and I think we're ready for a break now, is that?
Yeah, so thank you, Dr. Thomas.
And I'll be up here if anybody wants to ask any more questions.